Scope of mental health nursing means it is a range of roles, functions, responsibilities, and activities a psychiatric nurse can do it. The scope of mental health nursing are psychiatric consultant, case manager, gero psychiatric nurse, parish nurse, telehealth nurse, nurse researcher, psychiatric nurse educator, nurse administrator or manager, nurse pharmacologist, holistic care. So these are the different roles of a psychiatric nurse. The first one is psychiatric consultation. Psychiatric nurse who works in a psychiatric setting and provides necessary support, guidance, and counseling for those affected with anxiety, depression, and other psychological problems. She works as a liaison between a psychiatrist and other clinical team members. Psychiatric nurse usually in this setting supports, guides, counsels the mentally ill people. Next role is a case manager. Nurse manager acts as a advocate by coordinating care and linking patient with physician and other members of healthcare team. Works in community and helping daily living of a mentally ill person such as transporting, managing money, buying things, etc. Case manager is a person who works in the community. Psychiatric consultant works in inpatient department. Psychiatric case manager she will be managing, advocating the case. That means supports or suggests an idea to a mentally ill person. These people will coordinate the care with the physician, inpatient department, and other health team members. These people won't be working directly in the inpatient department. They will be there in a community level, but they coordinate the work, and these people help in the community of a mentally ill person regarding the daily living activities. Geropsychiatric nurse is a person who give care to the old age people. Geriatric people nowadays are increasing more because of the lifespan is increasing due to many reasons. In a developed countries, many of the old age people are there. They have started this geropsychiatric nursing. Those people will be providing care to the old age people, and this people, old age people have many of our behavioral emotional problems during the old age. This psychiatric nurse is a specialized nurse who can help geriatric people. Next one is parish nurse. She is a registered nurse with a spiritual mature. Parish nursing is an intentional integration of the practice of nursing with the beliefs of religious community. These people integrates the care with the religious things. Parish nurse is a registered nurse specialist who encourages physical and spiritual health and wholeness by developing and learning programs with the faith communities. These people will be teaching to the mentally ill people to have a faith in their recovery, and along with the other treatments they also give a spiritual health they provide based upon the person's religion. They encourage us to have a faith in their own God, and that persons we call it as a parishioners. Telehealth or telenurse. Nurses engages in a telenursing practice, uses technologies in treating the cases. This is a very popular in a developed countries, but in developing countries as like in India, it is recently come up in many of the hospitals. People are understanding importance of it and accepting it. The telenursing or telehealth is nothing but treating the cases through internet, computers, telephones, digital assessment tools, telemonitoring equipments. See, for example, this classes or e-learning techniques, you all learning things from your home. The same way, the patient can be there at home and they can talk to the doctor, psychiatrist and nurse and take care at home itself. And they deliver nursing care through the internet, computers and telephones. And in India, around 10 hospitals are having this telemedicine departments. For example, Apollo Hospital, Narayana Hrudayalaya, they started the telehealth. Nurse researcher is a person who designs and conducts and disseminates the findings. It's nothing but the researcher takes initiation to select a problem and conducts the research. After conducting the research, they communicate their findings through the professional meets. Professional meets means, for example, conferences and workshops. They present the paper presentation, so that people who all attend to that meets, they come to know the findings of that particular research, and also they will be printing in a peer reviewed journals. They publish this researches in journals, and they are mainly doctorally or postdoctoral preparations. These persons will initiate and participate in all the process of research process. In all the phases of research process, compulsory this researcher should get involved and check each and everything and do the research in a proper manner. These people we call as a nurse researchers. Next one is psychiatric nurse educator. A nurse educator is a nurse who teaches and prepares licensed practical nurses and registered nurses for entry into practice positions. For example, your teachers are training you people. After completion of your course, you will become a licensed practical nurses or registered nurses. They are preparing you people, so those people we call them as a nurse educators. And also, not only teaching to the students, the nurse educators teaches in a various patient care settings also. They provide teaching to the patients as well as provides continuing education to the licensed nursing staff. Nurse educator post is there in each and every hospital. Nowadays it is made mandatory. So nurse educator will teach continuously to the staff who are working in the hospital. They conduct everyday classes to the nurses so that they update their knowledge. Psychiatric nurse administrator or manager. Nurse administrator or manager means these people manages the nursing personnel. That means nurses who are working in the hospital, they manages, and also they supervises the patient care and facility resources available in the hospital through the support of regulating the policies. And the nursing administrators, psychiatric nursing administrators are responsible for ensuring that hospitals or other healthcare facilities operate in a safe and cost-effective manner. They also check the safety of a client. They achieve this through the management of financial and human resources. They supervises the nurses and other healthcare team members. Nurse pharmacologist is nothing but an independent nurse practitioner. This is recently came to our India also. In foreign countries it's already there. Many of the nurses are practicing the nursing. They are treating the minor problems. They have an authority to prescribe the medications to the minor problems of our clients. And the nurse pharmacologist is nothing but she is a psychiatric clinical nurse specialist who is having an authority to prescribe the drugs for the minor mental health illnesses. And these nurses can take help from a psychiatrist also in treating the cases, or refers the cases when it is difficult to treat. They will be referring the cases to the psychiatrist. And next one is a holistic nurse. Holistic nurse integrates the complementary and alternative modalities. This holistic nurse provides the care along with the other services. They may use the complementary and alternative modalities also in treating the client. For example, there are so many complementary alternative modalities are available, like acupuncture, aromatherapy, herbal medicine, homeopathy, massage, medication, spiritual energy healing, yoga. These all the complementary alternative modalities. Along with the this medicines, they also may choose this kind of techniques to treat the mental illnesses. That nurse is called as holistic nurse.